I'm ready for the employee engagement survey. Are you? This is your opportunity to tell us how we can improve your work environment and make Bon Secours a better place to work. So, beginning May 2nd, take a moment and tell us what you think. But remember, your answers will be kept completely confidential. Bon Secours and you, a good match. Take the employee engagement survey.
From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is engagement, as in employee engagement. Every year, Bon Secours holds their employee engagement survey to find out just what you think of Bon Secours. This year, the survey runs May 2nd, that's today, through May 15th, 2011. And it's your opportunity to tell Bon Secours what you think. The survey is really easy to take and only takes a few minutes, but let me give you the lowdown anyway. By now, you should have received your Gallup Q12 Employee Survey 2011 help sheet in the mail. If you have not, please contact your local human resources representative. Keep your help sheet handy. It has your access code and call-in number on it. So, to participate, just call the number on the help sheet, enter your access code, and answer the 12 questions, which, by the way, are on the back of the help sheet. Phone lines are open 24 hours a day, 7 days a week through May 15th, and you can call toll-free from anywhere in the U.S. or Canada. But you've only got 2 weeks to do it, so why not do it today? Now, here's why you should participate. First, it's easy. Next, it's completely confidential, and it will help improve your work environment. So think about it. If you participate in the survey, you get a chance to tell Bon Secours what you think, confidentially, to help improve your work environment. On the other hand, if you do nothing, what do you think will happen? The Bon Secours Employee Engagement Survey. Good help comes in many forms. This is one. Bon Secours and you, a good match. In other news, Bon Secours Health System has been recognized by the Agency for Healthcare Research and Quality for the adoption of the preventive healthcare guidelines and implementation of those guidelines in Bon Secours Connect Care, our electronic medical record system. Bon Secours is using the U.S. Preventive Services Task Force recommendations in Connect Care, and that's helping clinicians remember to order preventive care for their patients. But what is the U.S. Preventive Services Task Force? Well, the U.S. Preventive Services Task Force is an independent panel of non-federal experts in prevention and evidence-based medicine and is comprised of primary care providers. The U.S. Preventive Services Task Force conducts scientific evidence reviews of a broad range of clinical preventive health care services, such as screenings, counseling, and preventive medications, and develops recommendations for primary care clinicians and health systems. These recommendations are published in the form of recommendation statements, and Bon Secours is using Connect Care to access those recommendation statements. Medical Director of Ambulatory Informatics, Edward Glenn, M.D., says that by participating in the Agency for Healthcare Research and Quality's Preventive Services Selector Knowledge Transfer Project, Bon Secours can turn to a single trusted source for building its health maintenance and best practices alerts in Connect Care. In 2010, when Bon Secours decided to begin using health maintenance alerts, the physician design team went with the U.S. Preventive Services Task Force recommendations because of the advantages of using a single entity for consistency and simplicity. Ultimately, the guidelines and reporting functionality were designed to provide 3 levels of data. Patient-centered data, focusing on the individual patient encounter, panel-level data for each provider, and population management data across all providers throughout the health system. Of course, there are always challenges with any new process, but according to Dr. Glenn, patience and persistence are required for implementing the U.S. Preventive Services Task Force recommendations as health maintenance alerts. And in the end, with Bon Secours, it's all about the patient. According to Dr. Glenn, providers should persist in implementing Preventive Services Selector because it is right for the patients and right for the future. You can find out more about the Agency for Healthcare Research and Quality online at www.ahrq.gov. Finally, beginning May 6th is National Nurses Week. National Nurses Week begins each year on May 6th and ends May 12th, Florence Nightingale's birthday. And even though May 6th is near the end of this week, let's talk a little bit about the facts associated with National Nurses Week so you can be prepared for it. Did you know that there are nearly 3.1 million registered nurses in the United States, and 2.4 million of them are actively employed? Did you know that National Nurses Week is supported by the American Nurses Association, and the American Nurses Association was founded in 1896? Here's a good one. Did you know that RNs top the list of the 10 occupations with the largest projected job growth in the years 2002 through 2012? And although RNs have listed among the top 10 growth occupations in the past, this is the first time in recent history that RNs have ranked first. Here are some more numbers you may find interesting. Did you know that there are over 240,400 advanced practice nurses in the United States? Of these, approximately 144,200 are nurse practitioners. 69,000 are clinical nurse specialists. 14,600 are both nurse practitioners and clinical nurse specialists. 13,700 are nurse midwives, and 32,500 are nurse anesthetists. And did you know that research indicates that advanced practice registered nurses can provide 60 to 80% of primary care services as well as or better than physicians and at a lesser cost? Well, those are just a few of the facts we learned from visiting the American Nurses Association website at www.nursingworld.org, and there are lots more. Nurses are a huge part of the Bon Secours landscape, and we want to help all nurses everywhere celebrate this annual event. So, look for a nurse near you and thank them for all they do to help live out the Bon Secours mission of being good help to those in need. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.